All right, let's jump right in. Today, we're opening up the playbook on a really important health topic, coronary heart disease. We're going to break down what it is, what puts you at risk, and, most importantly, what you can actually do about it. So, let's get to it.
Seriously, just picture that for a second. A traffic jam happening inside your chest. Sounds kind of strange, right? But honestly, it's the perfect way to picture coronary heart disease, and that's the core idea we're going to be exploring today.
So first things first, let's talk about what's actually going on. What is this plumbing problem that can happen inside our hearts?
Okay, so think of your heart as a powerful muscle. And like any muscle, it needs fuel to work, right? That fuel is oxygen-rich blood, and it gets delivered through these special little pipes called coronary arteries. Now, with coronary heart disease, or CHD, these crucial fuel lines start to get clogged up with this sticky gunk, plaque it's called, made of fat and cholesterol. As those pipes get narrower and narrower, less blood can squeeze through, and the heart muscle starts getting starved of the oxygen it desperately needs.
And when the heart doesn't get its fuel, well, the consequences can be incredibly serious. We're talking about things like chest pain, what's known as angina, or a full-blown heart attack. Over time, it can even lead to heart failure or, in the worst cases, sudden death. This is exactly why getting a handle on this is just so important.
All right, so to really tackle CHD, we have to put on our detective hats. We need to understand the clues, the risk factors that can lead to this condition in the first place.
And here's the thing. These risks pretty much fall into two big buckets. On one side, you've got the factors you can't change, the non-modifiable ones. But on the other side, you have the factors that are very much in your control, the modifiable ones. Really understanding this difference is the key to everything.
So let's start with the stuff that's, well, kind of set in stone. The factors we're born with or that are just a part of life. Acknowledging them is the first step to figuring out your own personal risk profile.
These are what we call the givens. As we get older, our risk naturally goes up. Statistically, it's more common in males. And then there are the really big ones, your family history and specific genetic factors that can just make someone more likely to develop it.
And I want you to pay close attention to this point about family history. See that word independent? That's huge. It means your family history is so powerful that, all on its own, it can significantly raise your risk no matter what your other habits are. It's why knowing your family's health story is just so critical.
Okay, so we've covered the things we can't change. But please don't feel discouraged by that, because this next part, this is where the real power is. Let's talk about what's in your hands.
And this is maybe the most empowering message of all. You can't rewrite your genes or turn back the clock, but you have a massive say in how the rest of your heart story is going to play out.
So let's zero in on the 4 main risk factors we can directly influence. We're talking about smoking, high blood pressure, high cholesterol, and how much alcohol we drink. Think of these as the big 4 when it comes to fighting back against coronary heart disease.
Let's put a real number on one of those risks. When we talk about cholesterol, a key number to keep in your head is 200 milligrams per deciliter. If your levels are above that, you're officially in a high-risk category. It's a super clear, actionable number to know and talk to your doctor about.
Now, let's talk about smoking for a second. The impact is, well, it's staggering. A full 65% of deaths from heart disease in people under the age of 65 are linked directly to smoking. That makes it the single biggest changeable risk factor for that age group. Just incredible.
Okay, so we understand the problem, and we've decoded the risks. Now for the final and I think most important section, the actual game plan. The actionable steps you can take to protect your heart. This is your playbook.
The very first play in our book, the absolute cornerstone of this whole strategy, is building what's known as a prudent diet. Think of this as the nutritional foundation for keeping your heart healthy and strong. Now, prudent diet might sound complicated, but it's not. It's really about hitting a few key targets each day. You want to keep your saturated fat intake to less than 7% of your total daily calories. Keep your dietary cholesterol under that 200 milligram mark we just talked about, and aim for less than 5 grams of salt per day. Those are your goals. And hey, if you're trying to figure out how to remember that salt target, here's a fantastic little trick. The S in salt looks kind of like a 5, right? Well, that's your daily goal, less than 5 grams. Simple, memorable, and it really works. But diet is just one part of the playbook, There are other absolutely essential moves to make. Getting active with regular physical activity,
keeping an eye on your weight to stay in a healthy range, and of course, the big ones we've already hit on, quitting smoking for good and getting your blood pressure under control. It's a whole strategy where every single play supports all the others.
And look, if you need one more piece of motivation to quit smoking, this is it. Just 10 years after you quit, 10 years, your risk of heart disease drops all the way down to the same level as someone who has never smoked. It's an absolutely powerful reminder of your body's incredible ability to heal itself.
So as we wrap this up, it really all comes down to this one question. We've seen the problem, we've decoded the risks, and we've laid out the entire playbook. The only thing left is, what's the first play you're going to make? What's that one small, totally manageable change you will commit to for your heart starting today?